And so, first of all, I wish to thank Esaote for kindly inviting me to participate in this symposium and to have this great opportunity to present on high-resolution ultrasound of the wrist and hand, which is one of the most fascinating applications of musculoskeletal ultrasound. And today we'll use two screens. On the left screen, we'll give a theoretical lecture on ultrasound anatomy of the wrist and hand. And at the same time, we'll try to reproduce the same images obtained on the cadavers with this ultrasound equipment using high-frequency transducers. And so today we'll talk on different structure, including tendons and retinacula, nerves, ligaments, and joints, and dividing the wrist and hand into two main compartments: the ventral one and the dorsal one. And starting with the ventral one, by placing the transducer over the forearm, we have to consider 4 layers of structures. Remember, the first superficial layer includes 3 tendons. The most radial is the flexor carpi radialis. Then there is the palmaris longus, and on the ulnar side, the flexor carpi ulnaris. And you can palpate this tendon when you clench the fist. This is the flexor carpi radialis, this is the palmaris longus, and the flexor carpi ulnaris is located here on the other side of the wrist. Then, deep to these 3 tendons that are palpable structures, we have a very large muscle, the flexor digitorum superficialis. You see, it extends from the radial to the ulnar side of the forearm. It will give off 4 tendons, 4 flexor tendons to the 2nd, 3rd, 4th, and 5th fingers. There is another layer, a deeper layer, containing 2 muscles, and the flexor pollicis longus and the flexor digitorum profundus. And finally, a 4th layer in which we have 1 muscle only, the pronator quadratus. This is a pronator muscle, and therefore the fibers in these muscles are oriented horizontally. Therefore, remember 3 superficial tendons, a very large muscle structure located just deep to them, the flexor digitorum superficialis, then 2 other structure, 2 other muscle, the flexor pollicis longus and the flexor digitorum profundus, and finally the pronator quadratus. And now we try to demonstrate the structure by placing the transducer over the ventral aspect of the distal forearm. We will use a 12 megahertz transducer. Okay. This is the image in which this is a transverse plane in which you see the radius and the ulna, and superficially you see the radial artery. This is the first tendon, the flexor carpi radialis. This is the palmaris longus. You see a very thin superficial tendon, and going on the ulnar side we see the flexor carpi ulnaris. If we consider these 3 structures, the most superficial layer, this is the flexor digitorum superficialis, which appears as a hypoechoic structure like muscles. And inside this muscle, you can differentiate the tendons for the 2nd, 3rd, and 4th fingers. If I ask the patient to flex and extend the fingers, you see the motion of this tendon and movements in the muscle. Deep to this muscle, we have the 3rd layer with 2 other important structures. This is the flexor pollicis longus. Therefore, when I flex and extend the thumb and not the finger, I see only the structure moving. And the other one is the flexor digitorum profundus. Note the position of the intermuscular tendon of the flexor digitorum profundus. These tendons are located superficially. This hyperechoic layer is an interface separating the superficial from the profundus muscle. And deeply, lastly, we have the pronator quadratus. This is the radius, this is the ulna, and you see here the pronator quadratus as a horizontally shaped muscle. It serves to pronate the wrist. Therefore, the fibers are arranged horizontally here. When we place the transducer in the long axis over the wrist, we see the flexor digitorum superficialis, the flexor digitorum profundus as they glide, and deep to this muscle, this is the pronator quadratus. You see that the orientation of the fibers in this muscle is completely different. We go more distally now, and the tendons coming from the flexor digitorum superficialis and the flexor digitorum profundus enter the carpal tunnel, which is an osteofibrous tunnel delimited by the carpal bones and roofed by the flexor retinaculum. We have 9 tendons in the carpal tunnel, and these tendons are 4 slips from the flexor digitorum superficialis to the index, middle ring, and little finger. The other 4 tendons, respective tendons from the flexor digitorum profundus and the flexor pollicis longus, which lies on the most radial part of the carpal tunnel. This is a cadaveric image. You see that the carpal tunnel is a confined space, and these tendons are closely opposed together. These are 9 tendons. The other 3 tendons run outside the carpal tunnel. Therefore, the flexor carpi radialis will run very closely to the carpal tunnel, but outside it. You see the tendon indicated here with 1 is the flexor carpi radialis, and you see that this tendon runs in close proximity to the ventral aspect of the 3 scaphe joint here. Now we'll see the flexor tendons at the carpal tunnel level. Starting with the previous scans, on the transverse planes, I see the flexor digitorum superficialis, the flexor digitorum profundus. These are the tendons. And moving the transducer distally, I see that the muscles disappears and the tendons enter the carpal tunnel. These are the tendon in the carpal tunnel. This is the tubercle of the scaphoid on one side, the pisiform on the other side. And when we ask the patient to flex and extend the fingers, we see these tendons, the tendons as they move in the at the carpal tunnel level. If I now flex the thumb, I see the flexor pollicis longus as it glides on the most radial part of the carpal tunnel. More distally, the tendons diverge to reach their different insertion into the fingers, and they assume a typical arrangement at the level of the palm, in which you have 2 tendons for each finger, the superficial and the deep tendon aligned over the metacarpal. Therefore, the 2 tendons for the second finger aligned over the second metacarpal, the 2 tendons for the third finger aligned over the third metacarpal, and so forth. And there are other structures located in between these tendons. This muscle, this is the lumbricalis muscle, and the neurovascular bundle with the common interdigital artery and the common interdigital nerve. More deeply, you will have the ventral interosseous muscles located on each side of the metacarpals, and we can obtain the same image by placing the transducer at the level of the mid-palm, and we see superficially the tendons here. These are the metacarpals. The superficial tendon of the third finger. This is the deep tendon, lumbrical muscle, the nerve, the artery. The other 2 tendons, the lumbricalis again, the nerve, the artery, and deep to this hyperechogenic layer, we see the ventral interosseous muscle located in a deeper position.